Every single day in my clinic, my patients tell me just the most dismissive comments that their doctors have told them. And if I actually had time to write a book of all the things that I have heard that to me were just so distasteful and harming, trust me, I would. However, I don't have the time to do so. In today's video, I want to talk about 3 reasons why you might get dismissive comments from your doctor and the psychology behind that. Because if we can unpack that and you could better understand it, you will be better armed to have a really good conversation with your doctor, especially when it comes to menopause and or the use of hormone therapy. So if you're interested in that, stick around. I'm Heather Hirsch. I'm the clinical program director of the Menopause and Midlife Clinic at the Brigham and Women's Hospital, where I see patients on a consultative basis for all things midlife and menopause, and I could not love my job more. In fact, if you have seen me and you're a patient of mine, or you just watch my videos, you will know that this is something that I talk about and think about and read about every single day. And to serve you on all these different platforms, as well as to see you as a patient, is just such a pleasure of mine. Now, if your dream is to see me in the office, but you live far away, I highly recommend you check out my masterclass, the Reclaiming Menopause Masterclass. The description is in the link in the bio. So definitely check that out if it sounds like something you're interested in. All right, so why is your doctor giving you these dismissive answers or responses to your questions about menopause? Well, the first is they're scared. They're scared that they're not going to know the answers and you're going to rat them out. You're going to somehow know that they're not really knowledgeable in this area, and that scares them. They're human. Doctors are human. And so it is normal to feel all the feelings you would feel at any other job, but they're scared that they don't know the answers. And the reason they don't know the answers is actually probably not their fault. If you ask me, the problem lies in the medical education system. Research shows that medical students on average get 1 hour of menopause education during their 4 years of medical school, and that residents in OBGYN and internal medicine do not feel prepared to answer even basic questions about menopause or to prescribe hormone therapy. Now, most training doctors have been training in the last 2 decades where hormone therapy prescriptions have not been written very commonly, and so they've actually never even seen hormone therapy be prescribed. And so they might feel really scared when you ask them because they don't want to be found out that they don't know what the heck you're talking about, or they actually might be scared that you know more than them. So when a physician may feel scared, they might try to scare you in return. Oh, hormone therapy increases the risk of breast cancer. Well, if you watch my video here, you know that that's actually not even all that true. And so they may try to scare you unnecessarily. Oh, your grandmother had breast cancer. Well, you really shouldn't take hormone therapy. That's also a scare tactic. Oh, this can increase the risk of clots or heart attacks. We also know that's not true. If you look at my video here on the benefits of estrogen and your cardiovascular outcomes. So they're using scare tactics because they feel scared. The second is they may also feel really embarrassed. Embarrassed that they don't know anything and embarrassed that you may know a little bit more. So they might kind of brush this off with some sort of silly or dismissive comment like, oh, we all have to suffer through that, or I suffer too, or gee, there's just nothing you can do, or just, oh, you're just too young, because they don't want to actually ask you more questions because they're not going to know what to do. And so they're kind of feeling embarrassed that they don't know the answers to those questions. And so they may brush it off with something kind of silly or seemingly trying to abruptly end that conversation. I've heard all sorts of things from, oh, hormone therapy is not going to help with that, or there's nothing you can do, none of which are true, and these are all really harmful and dismissive statements. And thirdly, your clinician may have a really strong bias about hormone therapy based on what they saw when they were training, or based on what they actually still heard from the media or their family members, because they're humans as well. And so if you're someone who's been considering hormone therapy and you've been digging through research and watching this YouTube channel from start to finish, and you know how safe hormone therapy actually really is, your clinicians may have a really deep-seated bias that hormone therapy is dangerous or that estrogen is dangerous despite a plethora of evidence to the contrary. So you may be dealing with a clinician who has a really strong bias, and they might not even know that they have that strong bias because they haven't revisited it in a very long time. That clinician may be busy either delivering babies or doing surgery or knee deep in stopping the opioid epidemic, whatever it may be, and they haven't really revisited hormone therapy. So if their immediate response is, oh, that's going to cause cancer, or we don't really do hormone therapy, or I don't believe in hormone therapy, that means that that doctor probably has a deep-seated bias that they really need to revisit. Now, it's hard to undo those, and the first step comes with knowing that you maybe have some implicit bias that you need to work through. And you could simply tackle this by really saying to your clinician, there has been a lot of evidence to the contrary that hormone therapy is fairly safe. And I really recommend you reading the NAMS 2000 Position Scientific Statement on Hormone Therapy. And I will leave a copy for you here, and maybe we can have another conversation. Or could you please refer me to a provider who's more knowledgeable on this topic? That might maybe hurt their ego, but if you say it in a way that's kind, right? If you poke them in their underbelly further, they're just going to get more and more irritated and deeper into their biases. So you really need to tackle this with some kind of empathy. And remember, it actually doesn't stem from them personally. It probably stems from the fact that the educational system is really broken here and that women are really invisible after they have children. It's a significant problem with the way we're taught women's health, because we are taught women's health based off of what we know about men. So inherently the system is really broken, but dealing with a clinician who may be either dismissive, who may be scared, embarrassed, or biased is something that I wouldn't just walk away from without actually trying to give them some tools to help you or potentially help some other women who come after you. Now, if you can't get anywhere with your clinician, I totally get it, and I recommend going to either the NAMS website, which is menopause.org, and searching under Find a Provider, or ISWISH, that's the International Society for the Study of Women's Sexual Health, and looking under there for a provider, because these providers tend to have a lot more knowledge on hormone therapy and should all be working under the guidance of the NAMS position statement, which say over and over again that hormone therapy, when used within 10 years of menopause, has a lot of benefits, specifically for women without any contraindications to estrogen who are suffering with symptoms. I talk all about this and more in my Reclaiming Menopause Masterclass. I would love to have you join us. If not, definitely check out all my free resources below and keep watching my YouTube channel. So like and subscribe to this channel so you don't miss any notifications. It's free to do so. You can always change your mind, and I hope that this was really helpful. So remember, your clinicians are people too, and we all need to work together to help improve women's health at midlife and beyond, and I need you in the fight with me. All right, everyone, have a great week, and I'll see you next Monday for a brand new video. Bye.